Good morning and welcome to our Good Health program brought to you by Good Shepherd Healthcare System and the KOHU studio. I'm Caitlin Kozad, the host for Good Health. Joining me this morning is board-certified hematologist and oncologist Dr. Canon Milani. Dr. Milani, thank you for joining us.
My pleasure to be here today. Thank you, Caitlin.
So Good Shepherd is very excited to welcome you to our medical staff officially. I know you've been with us now for about a month. Tell us about your role at Good Shepherd Cancer Center.
Well, first and foremost, it's a pleasure and privilege to have joined the Good Shepherd medical community. I really feel at home even after such a short tenure in Hermiston, Oregon, and it's been actually a real delight to meet the team and interact with the staff, and in particular take care of really exceptional patients. What really stands out for me in Hermiston is just that folks are just salt of the earth, and it kind of harkens back to my time in New England where folks in Boston, Providence, any of those cities, you name it, what you see is what you get, and I really appreciate the sincerity and just the genuine nature of the community. So I'm really excited to be here.
And what inspired you to become a doctor in the first place?
That's a great question. If I can just share a personal story, I saw my mom several years ago go through a cancer journey herself, dealing with a gynecologic malignancy, and just a very special bond she formed with her treating team, in particular the nursing team at her cancer center and the oncologist that took care of her. It was just such a touching journey for me to see that, and just the way she was cared for was truly inspirational. And I thought, wow, what a role these folks play on a daily basis, and that's something to truly or potentially emulate down the line. And so that's truly what inspired me to enter the field.
And where did you attend school?
Yeah, so my mom's background was of Polish origin, and many summers when we were growing up, and just we had an opportunity to travel throughout Poland and within that area in Central and Eastern Europe, and I just fell in love with the culture and everything it had to offer. And so I enrolled in the university over there with the idea that I would initially, ironically, pursue a non-medical course. In particular, I was considering law at that point. But then what was interesting is that not just hearkening back to my mom's journey herself, and then ultimately what really brought me to medicine was that I started to teach English as a second language to students who were interested in coming to the States. And a lot of those students happened to be medical students, actually. And so just one thing led to another, and I ultimately enrolled in the pre-medical program there because I always had this keen interest and fascination with medicine anyhow, even though initially I had ironically enrolled with the idea of becoming an attorney. Having said that, life happens, and my interest really peaked within the medical sphere, so to speak, and ultimately I decided to pursue medical studies. And initially I was going to stay there and just basically adjust to the European lifestyle because I really enjoyed my time sipping on espressos and cappuccinos in cafes for endless hours, right? But then also reality set in the sense that I really wanted to enhance my medical education further, and obviously the best university institutions, hospitals, etc., are in the United States, and so that's what led me to the New England area and to Boston and ultimately Providence, Rhode Island.
What a journey you've been on to get to this point, and rich experience. So why did you choose to practice at Good Shepherd Healthcare System? Well,
it was time for a change. I've been in the Los Angeles marketplace for several years, and I really wanted a slower pace of life for myself and ultimately for my family. And so I had been to Oregon working out of the Quality Healthcare System late last year, and it was a phenomenal experience. I really enjoyed going throughout the state of Oregon, and I just like kind of the feel, or what I'm truly seeking for myself and for my family is really small town Americana, if I can use that phrase these days. And so it just really, I think it's just time for a positive change where life is a little bit slower, quality of life is emphasized, and traffic is practically non-existent from the perspective of someone living in LA. So it made very, very good sense, but in particular it's the people that brought me here.
Yes. And I read that you were the former chief of oncology at Kaiser in Los Angeles, or you served as a partner for 11 years. Can you tell us about that experience?
Yes, that was a remarkable experience. It really helped hone in my skills as far as team building, building rapport amongst different departments. It really piqued my interest in conducting clinical research for our patients, in particular seeking out clinical trials, not only earlier in the treatment cycle if required, but for late-stage treatment purposes as well. And we were building several pipelines within the oncology network, namely how to take care of patients as they battle their cancer, and namely the supportive care protocols, and also end-of-life care discussions about what should happen when they no longer seek therapy, or unfortunately when the cancer progresses past the point of no return. So we were able to really build some very important programs, and I hope to bring that sort of skill set to the community here in Hermiston and enhance what we have available here as well.
Yes, and so we're very excited to have you as part of the Good Shepherd Cancer Center team. So tell us about the services that Good Shepherd Cancer Center provides.
Yeah, I mean, I think a misconception sometimes is that the smaller communities do not necessarily have the capacity to offer all services required. And I have to say, just with the short time that I've been here, I feel that, yes, granted, we are a smaller cancer center, but that does not by any means signify that we lack a punch. And I feel that we're able to provide all the necessary services for our patients, dealing with any sort of malignancy at a very standard of care level and beyond. And so, of course, whether it's Los Angeles or Hermiston, if there are certain malignancies that require a tertiary level care, we do have the resources and, of course, the know-how how to provide that care or that reference for our patients. So I'll just namely use the example of bone marrow transplantation. Even in large metropolitan areas, there are only select centers that perform bone marrow transplantation for patients. And so that's not dependent on the size of the given city. It's just about logistics. So I really feel that we can offer all available services, meet the standard of care and beyond, and have the capacity to provide any sort of treatment modality that the National Comprehensive Cancer Network guidelines call for any patient in Hermiston as we speak. So I just want patients to understand that they're in a good place at Good Shepherd on their cancer journey.
So I've heard it many times that many consider you an expert in the field of cancer care. How long have you been doing this?
Well, this is the start of my 19th year, actually, and I can't believe it's been so long. Whenever I tell my kids that I grew up in the 80s, they feel like that's a bygone era. But it's been an amazing experience having the privilege to be a physician and be involved in the lives of so many patients, thousands of patients and their family members over the years. And I hope to continue to hone in on my craft, and I'm always striving to be a better doctor and certainly a better person. And so I think the fact that myself and the team is open to learning and is open to engaging with the new data as it pertains to the field of oncology and hematology, I feel our patients are going to be served very well in the community.
And how would you describe your approach to patient care?
Well, my fundamental philosophy is really to listen to the patient, and that may sound like a cliche, but what I mean by that is really I would like to emphasize a patient-centric approach to their care. Of course, irrespective of the type of diagnosis, there's always going to be the standard of care or evidence-based treatment plan available, but that's just on paper, right? So it's critically and fundamentally important to really understand the perspective of the patient, what their other medical conditions may be, what their philosophy of care may be, what their resources are. A patient who lives alone, perhaps, or doesn't necessarily have access to the hospital, they perhaps live far away, etc. We have to tailor that therapy a little bit differently as opposed to a patient who has an abundance of resources. So it's really important to understand who that person is, what their wishes are, and for us to really support that person on their journey. So that's really fundamental, as opposed to just walking into a room and let's say hypothetically a patient has breast cancer, just dictating care. I don't believe that serves anyone well. So we just want to make sure we approach this in a team-oriented manner.
Absolutely. What are some of the early signs that someone might have cancer?
Yeah, that's a difficult question to answer, because it's a common question, as you can imagine, that we receive in the clinic. For example, outside of the screening realm, let's say outside of mammography screening, colon cancer screening, cervical cancer screening, prostate, etc., many times cancers occur unexpectedly. And granted, there are some signs that are rather classic, for example, inexplicable weight loss, bleeding of any sort, for example, palpation of masses anywhere in the body. So there's some physical changes that can certainly be present. Those tend to be a little bit or manifest a little bit later. But ultimately, I think it's a matter of folks listening to their bodies. If symptoms arise that are not typical for your daily living, so to speak, it's important to communicate and convey that to your primary care doctor and to hopefully seek that specialty care that's required. So I think it's really important for folks to really not avoid problems, right? The earlier we can get to a suspicious-looking lesion on the skin or a lump or whatnot somewhere in the body, the better result we can potentially have for the patient. So just listen to your body. That's really the key. And the preventive care is very important at home. The way we eat, the way we move, and certain lifestyle measures, if we can potentially moderate our alcohol intake, or nowadays the recommendation is to completely eliminate it, but of course that's not necessarily realistic for a lot of folks, but we want everything in moderation. Of course, I think smoking mitigation is really important. I think if we can reduce the percentage of the folks that still consume tobacco, that would be tremendous as far as a preventative measure is concerned.
So you mentioned screening earlier. Can you talk about the role of screening programs in reducing cancer mortality rates?
So screening is really critical, especially now, as I'm sure the audience is aware of. Unfortunately, we have a increasing incidence and prevalence of younger folks being diagnosed with cancer in the United States, and we really don't have a good answer. There are various hypotheses or theories right now. One pertains to the foods we eat, perhaps. The gut microbiome is another hot topic that's being talked about. What is the imbalance in our bodies as far as the exposure to certain substances, foods? As everyone knows now, more is being found out about certain food dyes, food additives, preservatives, etc. And so I think as far as screening, it's really important that, just to come back to what I just said a moment ago, for people to really seek medical attention when something doesn't seem right. So even for our younger patients in their 20s, 30s, unfortunately, if they have, for example, an episode of rectal bleeding, we can't just ascribe that to a not or benign anomaly just automatically because someone is young. I think we have to take things like that very seriously. That's where screening comes into play. And right now, the U.S. Preventive Task Force, as in the last couple of years, has come out and said, we should consider screening, or they've recommended screening at the age of 45, for example, for colorectal cancer, given the increasing incidence in our younger population. So I think all young adults, men and women both, really please fundamentally reach out to your primary care doctors if you see something that's unusual. So I think I would highly advocate screening for the entire population as it pertains to the more common cancers stemming from breast, lung, if you have a smoking history, for instance, colon, prostate, etc. So I think it's going to be really important to have a robust screening program, and for patients to adhere that to the best of their capacity to prevent, hopefully, cancers manifesting at a later stage.
And can we talk about treatment now? What's your philosophy around treatment options for cancer?
Yeah, so what's really fundamental is the patient in front of us. And the age-old adage that my mentors passed on to me, more than 20 years ago was, what is the performance status of the patient? So that's a technical term we use in oncology. So in essence, who is in front of us? Did they walk into the clinic on their own accord? Are they coming into the clinic in a wheelchair? What are their medical conditions beyond the cancer diagnosis, for example, and what are the goals of care? Are we in the early setting for therapy? Are we in the latter stages, given the extent of their cancer burden? So I think it's really important to see who is in front of us and what is realistic, and ultimately balance that with the person's perspective, right? We really want to involve our patients to the best of their capacity and really support them on this. As I said, I think a practice principle really is fundamentally to bring that patient perspective into play, because that lends itself to just a more successful journey for that patient and perhaps their family members who are accompanying them on that journey as well.
And what recent advancements in hematology and oncology are you most excited about, and how do you see them affecting patient outcomes? Yeah,
so over the course of the last several years, in particular, I would say the last 5 years, we have a better understanding of the genetic profile of tumors. We have a better understanding of the role of the immune system, our own innate immune system, and its interplay with cancers that afflict the body. And I think there's a lot of excitement pertaining to how we can basically stimulate our own immune system to help not only ward off cancer, but of course try to mitigate the cancer. That is a really fundamental part of oncology care moving forward. Further, the entire scope of molecular profiling now, where we understand the genetics of the tumor much better, that is absolutely critical moving forward, because when we talk about breast cancer or lung cancer, it's just not one uniform term anymore. These are just umbrella terms, right? There's several subtypes of breast cancer, there are several subtypes of lung cancer, etc. So having that molecular or gene profile of the tumor and understanding that there are many different ways to tackle a different cancer nowadays has dynamically changed the treatment landscape. I'll just give you a quick example. About, let's say, 7 years ago, if I had to quote the 5-year survival rate for stage 4 lung cancer, which is an incurable form of lung cancer, for example, it was about 5%. And now we've brought it to nearly 30% with the advent of newer therapies. So a lot of exciting things are happening in oncology, and this is, again, we never want anyone, of course, to be diagnosed or afflicted or impacted with cancer, but I just want to assure the community that there are solutions, there are tools available, and we hope to do our best to get them through this particular time in their life. So maybe you could share a recent patient success story, or one that was most impactful to you. Yeah, I think I had a case recently, and this is just a reminder of the importance of listening to our patients and really hearing them out. And I think, I recently treated a young woman in her 40s who had a child, and she was dealing with an incurable cancer. And a lot of tough social dynamics. She was the primary breadwinner for the family. She was still the provider for her parents as well. So multi-generations living under one roof. And now imagine that person is afflicted with a very serious cancer and has a young child in elementary school. And so very jarring to start with. A lot of dynamics involved there, so from a psychosocial perspective, naturally. And, myself and my team, we really wanted to understand what this particular person is dealing with. And, of course, we've treated many patients like hers over the past several years. But what really stood out and what was really inspirational for me, and what, it was just going back to just the basics, and what she said to us, and what was really moving is she said, I see hope in your eyes. Mm-hmm. And that really impacted me. We were obviously doing everything we can as a team for her, but the fact that she said that was really instrumental in motivating us even further to understand what she needed and to get through this journey for the period of time that she's here. And so it's really important to have that open line of communication with patients, and something as simple as that, a statement that she sees hope in the eyes of her treating team. I just was really moved by that, even though I've been down this road thousands of times over the years. But sometimes you need these sorts of reminders to really understand what folks are dealing with.
Oh, that does sound impactful. I love that story. And is there anything else you'd like to share with our community today?
Yeah, so I'm excited to announce to the community that we have another oncologist coming on board, Dr. Farnoosh Bar, over the course of the next few weeks, who's joining Good Shepherd as well. And so she's a dynamic oncologist, and I think just having both of us there on board, not only helping individual patients, but being able to cover one another's patients in the event someone is not in town, for instance, is a big boost for the Cancer Center. And I think it'll provide patients a greater degree of access locally, so they don't have to travel further outside of this area. So I think that's what we're very excited about.
Yes, that is our aim, exceptional care close to home. Just so excited to have you as part of the team. And as you mentioned, another amazing provider coming soon to the Cancer Center. What a tremendous impact, positive impact this will have on our communities. So it's time to wrap up Good Health today. I want to thank Dr. Milani for joining me this morning to get to know him and the services provided at Good Shepherd Cancer Center. For more information, you can visit our website at www.gshealth.org, or you can call 541-667-3615. Be sure to check out our Facebook page, where we'll post a link to today's program via podcast. Dr. Milani, thanks again for being here today.
My pleasure to be here. Thank you.
Again, this is Good Health, brought to you by Good Shepherd Healthcare System in the KOHU studio. Thank you for joining us, and be well.